As the health care reform debate goes on at the nation's capital and across the country, there is one new health idea putting the emphasis on quality care. It focuses on paying doctors based on keeping patients healthy. If doctors encourage their patients to better manage chronic health conditions, their patients are less likely to end up in a hospital emergency room. Nadine Arroyo Rodriguez shows how one Valley neighborhood is already benefiting from this preventative health strategy.
Good morning. How are you doing?
Okay.
Your neighborhood healthcare center opened its doors to Southwest Phoenix area residents in 2008. The clinic is a general family practice center. Founders of the center say the community needed a clinic that provided more than just health services. They also wanted to provide wellness and preventative care, something they say is desperately needed in the Latino community.
Within this neighborhood, in a 1 square mile area, there are 1,700 households. The vast majority, and I'd say 98% Latino, and I'd say 70% are below poverty. So to get out and try to get into public transportation or their own transportation to drive someplace other than this neighborhood, it's very difficult. They literally can walk here and get all the services they need.
Services at the clinic range from internal and family medicine to pediatrics. The medical care providers are physician assistants, or PAs, who provide service under the supervision of a medical doctor. The center focuses on providing diagnosis and preventative care. PAs also counsel patients and record progress. These are the normal functions of a PA. However, what makes this clinic different than most in the Valley is that the PA takes the time to talk with the patient about problems, concerns, and treatment. And the clinic has specialists on call to provide preventative care ranging from pain management to cardiology.
Hey, Vicky. What's going on?
Same problem.
Same thing.
We address the physical need of the person, do a comprehensive physical evaluation. We do a psychological evaluation to get a baseline on folks. And then once they have had the evaluation and we identify what's wrong with them, then what we consider wellness is not only diet and exercise and those sort of things, but we manage their diabetes very tightly, we manage their blood pressure very tightly, and that's part of our wellness component. And we put the ownership on the patient to do the follow-through.
According to the American Academy of Physician Assistants, approximately 257 million people were cared for by physician assistants in 2008. Experts believe that rapid changes in medicine and the cost of medical services is causing an ever-increasing number of PAs in clinics. For the neighborhood center, physician assistants are a benefit for not only the patients, but the provider.
The providers are now saying, you know, our patients, your patients, are happier, they're taking care of themselves, so our costs are going down. So we're willing to pay you to spend extra time with the patients.
We keep them out of ER visits, keep them out of urgent care visits. We catch them before they lose their kidneys to diabetes. All of these things we do are actually cost savings as well as quality medicine.
Experts also say that with the length of time it takes to schedule an appointment with a medical doctor, more and more people are turning to physician assistants. Care providers here say for the Latino community, the issue is more about quality time with a care provider whom they can trust and depend on.
So if we can get in here today, better. You know, I'm going to give you something just to sort of tide him over until he does.
Garewal says the community has responded positively to their services. Now, there are 2 more of these types of clinics in the works.
It's about the care, it's about the education that we can provide to our community, and more importantly, if we can impact even the younger members of our community and help them to take care of themselves, they have longer, more enriching lives and healthier lives.
Joining me to talk more about your neighborhood healthcare center is James Ally, founder of the clinic and physician's assistant. James, thank you for joining us on Horizonte.
Thanks for having me.
Give us the genesis of the clinic and particularly why it's located where it is.
When we chose a place to open a clinic, we wanted an opportunity to be in a neighborhood where there was a need for quality health care, and quality health care that wasn't really being provided in that area. We selected the neighborhood in the Isaac School District area because the need seemed the greatest there. An opportunity came when the physician who owned the clinic was wanting to sell it. So we purchased the clinic, opened it up, and we established our model.
Now, even before you went to school to become a physician's assistant, you had experiences in the healthcare industry that gave you the ideas for how you wanted to run this clinic. Tell us about that.
Very much so. My original, upon graduating college, I worked in the healthcare industry, in pharmaceutical industry, then the hospital industry, home health industry, and sort of watched healthcare evolve in the Phoenix market. When I went back to school, I did much of my training at Mayo Clinic. And in managing and in watching Mayo Clinic, I was very impressed with not only the quality of their care, the comprehensiveness of their care, but also the business model that seemed to make a lot of sense and provided quality care at a reasonable cost.
And it's that model that you're implementing in your clinic?
As closely as we can, given the financial constraints in our market.
Now, most people would, if you told them you were employing the Mayo model in your clinic, would say they can't believe that, because Mayo is associated with, not only with high quality health care, but also with extremely high costs.
Right.
True or not, but that's the image.
And Mayo does a lot of charity care. So they do free care to those that need it, and they do provide those services. But they're very efficient in terms of the way they run their operation. And if you can add those efficiencies to a medical practice, you can easily implement cost savings that allow you to provide quality care and provide the time the patient needs. And I think that's the key.
Give us some specific examples how the implementation of the Mayo model in your clinic has had some impacts.
Well, in our clinic, when every patient that comes through the door, whether it's for a cold or whether it's for other kinds of disorders, we provide a comprehensive evaluation upon entry. That includes a comprehensive set of labs, comprehensive physical examination, and a psychological examination, at least cursory, so that we can address both the psychological and physiological needs of the patient. Once we've established what the disorders are, as in diabetes, we then develop what we call a holistic or a wellness program that, involves the patient in their own care. They take responsibility and accountability for their own care, and then they follow a set of guidelines to manage that disorder so that we can come out with positive outcomes and keep them out of the emergency rooms.
And if they don't follow the guidelines?
They're out.
Out of the program?
We don't mince words with them. We tell them that coming in, and if they want care at our clinic, they have to follow the guidelines.
And how has the community reacted to you and to your clinic?
Initially, they weren't sure. It was very different from what had been provided at that clinic. But over the last almost 2 years, we've been well accepted. We're treated like family wherever we go. We go into the high schools and provide services there, into the grammar schools and services there. And we're part of the community, and they tell us that.
Now, we already know that the demographics of the area you serve is predominantly Hispanic, but the clientele you have is actually fairly diverse.
It is very diverse. It's not uncommon to sit and look at our waiting room and find a homeless person or someone who lives in one of the shelters nearby, somebody in a three-piece suit, and a Hispanic family sitting all waiting to be serviced all at the same time and having conversations and just kind of enjoying the person in the moment.
And when we were talking earlier off camera, you even mentioned treatment for gang members who may show up as well, and yet they treat you fairly well.
Not only do they treat us well, they protect us. We've been told that we're all right. That was the word that was used. You're all right. Nobody's going to mess with your building. And we don't get graffiti on our building. Our building is never damaged. We've never been broken into. Yet we are in a predominantly gang area.
Now, what can we expect to see in the future? I know there's some building plans and also some expansion of services.
We are in the process of developing actually a multi-specialty clinic, not so different from the Mayo model. We want to put specialists under roof. The specialists that we brought in, such as our pain management specialists, they're the top in the city. They're top quality people that have come to this neighborhood to provide services to this group of patients. The cardiologist we have is an excellent cardiologist. We have oncologists and other specialists, all just waiting to come in.
We're almost out of time. You've got another